Assalamualaikum. Ultrascan diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest has not been highlighted, so we're going to show you the upper arch and all the implants associated. This is the panoramic view. We can see we've got 1, 2, 3, 4, 5, 6, 7 implant placed in the upper segment. This is the distal most implant in the upper right quadrant. As you can see that the implant is placed slightly buccally, and we do however have good bone support but a little bit of bone exposure on the upper right distal most implant. This is the molar region. Moving to the upper right, there we go, the upper right first molar region, and this implant also has better bone support. We've got good bone, we've got a little bit of a superficial implant placement, so hence bone exposure might be something to be considered in the upper right segment. Moving to the anterior segment, so this is the implant in the anterior 1-1 region. So here you can very clearly see that the implant is placed straighter, and there is a chance that it might be exposing on the dehiscence. It might have exposed on the buccal cortical plate. However, it is still center of the ridge. We don't see any periapical radiolucency or peri-implantitis here. This is the implant in the 1-2-1 region. This implant, however, is placed quite palatally, very close to the incisive canal, and it is actually very much palatal than the other implants. Now we do see palatal bone support, so we can't say it has exposed on the palatal aspect, but it is definitely much more palatal. Now moving to the upper left canine region. This is the center between the canine and the lateral. So this implant is placed in the center of the ridge. We've got buccal cortical bone support, we've got palatal bone support. We don't see any periapical radiolucency or any peri-implantitis in this region either. Moving to the implants in the first premolar region, this also is placed center of the ridge. We've got good bone support on the buccal as well as on the palatal aspect. And then moving on to the distal most implant on the upper left hand segment. So here also we can see that there is a good bone support center of the ridge. However, the buccal cortical plate seems to be very thin and narrowed down, so this is something to be mindful of. The axial view is going to be much more interesting. Here you can see this is the right side, this is the left side. When we're moving, the left implants have a little bit of bone support on the palatal side, but we do have bone exposure on the buccal side. These are the implants in the anterior right segment. This is the upper right lateral incisor region or central incisor region. This one is the upper left central incisor region, again placed quite center of the ridge and at the same time very close to the incisor foramen. This is the upper left canine, first premolar, second premolar region, and this is how they look on the X-ray. If there are any further questions, please feel free to reach to our team. Thank you very much.